Rock teen recovering from a rare post-COVID illness wants you to hear what the last 8 months has been like for him. He was diagnosed with a serious complication which impacts different body parts. Doctors are gearing up for a surge in this inflammatory syndrome in the coming weeks. As KXAN investigator Arezow Doost explains, they're concerned about the spread of the Delta variant among kids and teens, especially those eligible but unvaccinated.
Nico D'Alessandro is back in the game. He says he's finally feeling like himself, especially on the baseball field.
I'm just grateful to still be around and to be here right now.
In January, the 14-year-old was rushed to Dell Children's Medical Center after he couldn't shake a fever. He was quickly diagnosed with multi-system inflammatory syndrome in children, or MISC.
It was terrible. I was in the hospital for 4 days. I had constant IVs. I had this huge lump on my neck. I could barely move my neck. I was constantly sick. I was throwing up. It was not fun.
The illness strikes after a COVID-19 infection and can cause inflammation to the heart, lungs, kidneys, and brain.
We were afraid. I mean, we didn't know what MISC was at the time.
What long-term complications worry you guys?
It's more of his heart. We had to make sure we're checking his heart every 6 weeks now.
It's what doctors have been studying.
The inflammation that happens in the heart doesn't allow the heart to function as well. And when it doesn't function as well, the end organs, all the other organs in the body just don't keep up.
Dr. Karen Hasbani is a pediatric cardiologist at Dell Children's and says MISC shows up between 4 to 6 weeks after a COVID-19 infection. And right now, what worries her and other doctors is the surge in the Delta variant, especially among those between 12 to 17 years old.
Many children coming in with upper respiratory infection that then progresses to lack of oxygen, which is respiratory failure. About 25% of our cases have ended up in the ICU.
Dr. Sarmista Hager is the chief of pediatric infectious disease at Dell Children's. She says out of all the patients they've treated eligible to get the vaccine, only one has been vaccinated.
An adult that's eligible makes a decision not to vaccinate themselves. They are also having downstream consequences for their vulnerable people around them, including young children.
The risk of what we see if you get the disease is significantly higher than the risk of what you see from the vaccine.
I don't want anyone else to go through what I did.
It's taken Nico 8 months to recover. Before his MISC diagnosis, his parents say he was always healthy.
I would highly recommend wearing a mask and getting vaccinated so no one else can go through that. We can get done with this virus.
Nico was recently cleared to get the vaccine from his doctors and can finally do what he loves, play ball. Arezow Doost, KXAN investigates.
Dell Children's has been part of an international study that will look at the long-term impacts of the inflammatory syndrome in children. So far, 6 patients have enrolled from Central Texas. More than 600 are part of the study nationwide and from Canada. Dell Children's doctors you just heard from say the study is helping them come up with treatment plans quicker, and that's preventing kids needing to go to ICU. The CDC is also looking into cases in adults and says since June, there have been several reports of similarities to what children are experiencing. Well, at the end of August, Austin Public Health said a child died from COVID-19. It's the first death in the area since the start of the pandemic. APH said while the child was vaccinated, they had underlying health conditions. The state health department has reported 1 MISC death, a teen from the San Antonio area. Across Texas, updated numbers show 231 confirmed cases, up 30 from just 2 weeks ago. The kids and teens ranging in age from 1 month to 18 years old. The majority of cases remain to be among those who are Hispanic and Black.